Madam President, I have a recommendation for my colleagues in the Senate. I recommend, as the senator from New York does, and I do, they go home, literally leave Washington, go home and meet up with the people who sent them to Washington to work for them. I did last Friday, as I do every weekend, and I asked specifically to meet with 5 individuals who were out of work. I wanted them to tell me their story and to share that story with the people of Chicago. It was quite a moving experience. We have 800,000 Illinoisans who are claiming unemployment. And now there's a possibility that the $600 a week federal benefit that is coming to them to help pay their bills will disappear. Technically, it ended last Friday. So I asked these unemployed Illinoisans, tell me your story. Rashonda Williams told me a story of being a bartender for 19 years at the Palmer House Hilton before being laid off in March. She earned significantly more while working than she's receiving in unemployment. She is literally worried that she's going to lose her home and health care if she loses that $600 a week. Andre Marino worked in a restaurant in downtown Chicago before the pandemic. He was pretty proud of his career in working the restaurant business. He said, I did well. He and his husband have both lost their jobs and their health insurance. Without the additional $600 a week in unemployment compensation, they won't be able to even buy health coverage. Aileen Demery was an interesting person. She's in lighting technology. Her job involves big events. They set up the lights for concerts and other gatherings. Thousands of people. She said, nobody knows I'm there, but I do. I'm one of the first women who's ever been in this profession. Well, those big concerts and crowded venues aren't there anymore. Aileen doesn't have any place to go back to. She said one thing that still sticks with me. She said, I started working when I was 15. I've worked 36 years, she said. Do you know how many weeks, Senator, that I've had unemployment in the 36-year work experience? I said, no. She said, 1. This notion that I would rather stay home and draw unemployment than go back to work, she said, that isn't who I am, and I've proven over a lifetime that I'm a person who really does want to earn their pay. Her enhanced unemployment, if it expires, would mean that her bills, including paying rent, just can't be paid. Jesus Morales worked at the Drake Hotel in Chicago for 33 years. That made it up to $1,700 a week. He reminds me that I met him 20 years ago when he was a bartender and waiter at an event that I attended. Well, he's been laid off since March, and without the $600 payment, he's afraid he won't be able to make his mortgage payment, and the COBRA payment, which covers his health insurance for his family, would be impossible. Samantha Arce is a mother of 3. She just gave birth a few weeks before the lockdown began. Her place of work is closed and her fiance has lost his job. They quickly went from 2 working parents with 3 kids to no working parents. Enhanced unemployment pay has helped them pay hospital bills and care for their young kids. She brought a little boy. He's about 4 or 5 months old, cute little fella, smiled during the whole event. Little did he know what was going on in the mind of his mom and dad as she tries to cope with political decisions being made in Washington. Losing that $600 a week payment, which the Republicans have proposed, would really create a devastating situation for these families and these individuals. There's this notion, and I hear it regularly, I've heard it for a long time, that if you're unemployed, you're just not trying hard enough. There are jobs out there, they say. Well, that's not what the numbers tell us. There are 4 unemployed Americans for every available job. 4 for every available job. And employers who say, well, so-and-so would come back to work, but they're making too much on unemployment. Of course that's the case in some instances, but it's rare. Did you know that of the Americans who've gone back to work since we began this pandemic assault, of those who've gone back to work, 70% are making less than they made on unemployment? Well, why would they make that economic decision? To go back to work and make less than unemployment? Well, it's just like Aileen. They're workers. At their heart, they're workers. They believe in the dignity of work, and they're proud of what they do, and they want to go back to doing it, number one. Number two, they know unemployment is not forever. Number three, sometimes there are benefits when you go back to work that really count, like that health insurance policy that had the doctor in the hospital, which you and your family need. In June, the Illinois unemployment rate dropped to 14.6%, and the state added 142,000 jobs. But that unemployment rate of 14.6% is the greatest we've faced since the Great Recession. Since the beginning of March, around 1.7 million unemployment claims have been filed in our state of a little less than 13 million people. That's nearly 10 times the number of claims processed during the same period a year ago. Same thing's true in neighboring states like Kentucky, where the unemployment claims are 10 times what they were a year ago. Nationwide, around 30 million Americans are relying on enhanced unemployment benefits just to keep things together. Trust me, they tell me, we're not saving this money, we're not investing this money, we are spending this money as fast as it's handed to us to pay for our home, our car, utilities, food. The Republican approach would cut the unemployment benefit check from the federal government from $600 a week to $200 a week, a $400 cut. It would then require states to put in place a complex system of 70% wage replacement. It sounds so logical that if you're unemployed, you get 70% of your paycheck. Interesting formula. How do you make a formula like that work? Well, you have to gather a lot of data about what a person was earning when they were unemployed, and then put that into your computer in terms of the payout each state would make under this new formula. It's different than what states are already doing. And what we found out is states are very different when it comes to their computer technology. We were told that, incidentally, by the Trump administration when we established the $600 a week payment. They told us back in March, don't make this too complicated. Make it simple, a flat dollar amount, because these 50 states have computers that range in sophistication from primitive to the most modern. And they're not going to change these computers in time to help the people who are currently unemployed. The Republicans seem to have forgotten what we were told by the Trump administration when we initially enacted the $600 a week payment. This 70% payment for unemployment doesn't work if the computers can't make it work. And we're told it will take anywhere from 2 months to 5 months for these computer systems to even try. What are the families supposed to do, the ones that I've just described to you, while the computer systems are being retooled? And who's going to pay for the retooling? If the states can't implement this program, and instead the flat cash payment goes from $600 to $200 for month after month after month, trust me, the lines at the food pantries will be longer than ever. The Economic Policy Institute has estimated that cutting this benefit to $200 a week will reduce our gross domestic product by 2.5% and cost us 3.4 million jobs. Just what we need, more unemployment, thanks to the Republican formula. Research from the J.P. Morgan Chase Institute suggests the enhanced benefits have helped thousands of households continue purchasing critical needs, food, diapers, the basics. Allowing these benefits to expire will result in household spending cuts and a reduction in economic activity, exactly the opposite of what we need to do right now. This weekend on television, there was a governor from the Federal Reserve in Minneapolis who basically said this is exactly the wrong time to cut back on benefits to the unemployed. And when the questioner said to him, well, what about our deficit? He was very frank about it. Yes, for the time being, it will add to the debt of the United States. But if the economy recovers, which we all have to work to achieve, that recovered economy will be able to take care of that debt. That's something to keep in mind, too. It isn't just for the benefit of the families that are employed. It's for the benefit of the overall economy to put money back into it now. We learn in basic economics that if you want to get out of a recession, the first dollar the government gives away should be to the unemployed. They'll spend every penny of it, and they'll spend it and then have it respent into the economy over and over again. That's how you create consumer demand. That's how you create demands for business activities, goods and services. And so, Madam President, I want to make it clear from what I learned last Friday in Chicago. No one is getting rich off of unemployment. They're using their unemployment benefits to survive. Average rent is about $1,400 a month in this country. COBRA health insurance, where you pick up the health insurance policy from the employer who just laid you off, runs about $1,400 a month for a family, $600 a month for an individual. The average cost of food for a male adult in America between $200 and $400 a month. Add it all up, there isn't much left over. And if the Republican proposal of cutting $400 a week from each of these unemployed becomes the law of the land, try to make ends meet. Workers of color have disproportionate impact when it comes to this economic collapse. Overall unemployment was 11.1% in June. Unemployment among black workers, 15.4%, 14.5% for Latinx workers. According to the National Bureau of Economic Research, black households cut their consumption by 50% more, and Latino households cut their consumption by 20% more than white households. That is the reality. Let me address two or three particulars raised by the senator from Kentucky about the state of play as we try to negotiate a satisfactory conclusion and next step. First point, this week marks the third month since Speaker Nancy Pelosi and the House Democrats passed a rescue package. For 3 months, their effort, called the HEROES Act, has been sitting on the desk of Senator McConnell. Initially, he said, "I don't feel a sense of urgency to address this issue." Then he went on to say, "We haven't spent all the money we appropriated the first round." Whatever the reason, it wasn't until 7 days ago that the Senate Republicans kind of made a proposal. The only thing we seen specific in writing was their proposal for liability immunity, which I'll address in a moment. The rest of the things were oddly presented as potential legislation, which would be brought to the floor of the Senate. Imagine that. We have the White House and congressional leaders sitting down and negotiating, and Senator McConnell said, well, the Republicans will bring a bill to the floor. Well, if you follow the Senate, 6 or 8 different bills to the floor. First, why did they go through Republican majority committees? Second, how long is that going to take for us to debate and then negotiate between whatever we pass and what is pending in the HEROES Act? It makes no sense. But I'll tell you what makes even less sense. In the negotiations, these delicate and important, life-changing negotiations that are taking place on Capitol Hill, these negotiations to determine what's next now that the $600 federal payment has expired under unemployment, for example. In these negotiations, there are 6 chairs. 1 chair is occupied by the Chief of Staff to the President of the United States, Mark Meadows. Another chair is occupied by Secretary Mnuchin from the Department of the Treasury. 3rd chair, Speaker of the House, Nancy Pelosi. 4th chair, Chuck Schumer, Democratic leader of the United States Senate. But there are 2 empty chairs in this room for negotiations. Those 2 empty chairs should be occupied. One should be occupied by Kevin McCarthy, the Republican leader of the House. He's not there. He doesn't attend these negotiations. And the other, of course, should be occupied by Senator McConnell, the Republican leader in the Senate. He has enough time to come to the floor each day and criticize Speaker Pelosi's measure that she passed 3 months ago. But he apparently doesn't have time to attend the negotiations, which could resolve the differences between the House and Senate and finally bring to rest the concerns of millions of Americans about whether or not there'll be enough money coming in next week to pay the bills. It's pretty tough to come to the floor each day and criticize the Democrats for not showing success in negotiations when the Republican leader in the Senate is boycotting the negotiation meetings. What is that all about? I've been around here for a while. Never seen that before, where one leader is intentionally staying away from the negotiations. I don't see how that can end well. I see my colleague from Texas has come to the floor, and I want to say a word about a proposal which he is promoting and is likely to speak to this morning before I turn the floor over to him. Do you remember when Senator McConnell came to the floor over the last several months and said, "I'm drawing a red line. When it comes to any negotiations, this red line is liability immunity for corporations. And if you don't accept my language on liability immunity, there'll be no negotiations, there'll be no positive outcome." Red line. He made that speech over and over again as he warned us about the flood, the tsunami was his word, the tsunami of lawsuits that are going to be filed by people, by trial lawyers, these mischievous, frivolous lawsuits over the issue of COVID-19. So we kept wondering, when are we going to get to see Senator McConnell's liability immunity proposal? We waited week after week after week after week, nothing, just speeches on the floor. And then last Monday, it was unveiled, a 65-page bill. We finally got to see what he was talking about. Well, it's understandable why they held it back. It is the biggest giveaway to the biggest businesses in America in modern memory. This bill would literally override state laws that have been passed to deal with this issue of culpability and blame when it comes to the pandemic we face. Some 28 states have already enacted laws to deal with it. This McConnell-Cornyn proposal would override these state laws. And sadly, their proposal would give incentives to cut corners when businesses deal with health and safety in the midst of this pandemic. This bill would jeopardize frontline workers and families, and sadly, it would risk further spread of the virus. Here's my top 10 list of what's wrong with this bill proposed on liability immunity. The bill does nothing to protect workers, improve safety standards, or give businesses any incentive to take the proper precautions. We had a hearing in the Judiciary Committee, and I believe the senior senator from Texas was at this hearing, and a fellow representing a convenience store chain in Texas, his last name was Smart, was the Republican witness, and a very good witness, I might add. He told us how in the hundreds of convenience stores that he had around Texas, his company was literally doing everything they could think of to make the work environment and the customer's environment safe. He talked about social distancing and masks and sanitizers. They were doing everything they could, but his plea to us was, "Senators, what is my standard of care? What is the standard I'm expected to achieve? If I know that," he said, "I can move forward and meet that standard, and I'm going to. I'm just committed to it." And you know what? I believed him. I believed his with a good faith position that said he wanted to know the standard, the public health standard expected of him, and he would meet it. I want to tell you this. If somebody turned around and sued him afterwards because of that, I'm convinced there isn't a jury in America, let alone in Texas, that would find him to be guilty of negligence or recklessness. He did what he was asked to do. He followed the standards he was given, but his plea to us was, "Give me a standard. I don't know where to turn." That's what he told us. The second concern I have with this bill, it would gut existing state law and safety standards. It would federally preempt the right of workers and victims to bring cases under state law to seek accountability for coronavirus-related harm. And it would supplant state laws that require businesses to act with reasonable care. Under the bill, the only way a victim could hold a business liable is if the victim proves, by clear and convincing evidence, a higher standard than most, both that the corporation didn't even try to comply with the weakest available safety guideline, and also to prove that the corporation was also grossly negligent. I can just tell you, having spent a few years making a living as a lawyer, those are almost impossible standards to meet. Third, by setting the immunity threshold at gross negligence, the bill would immunize corporations from accountability for conduct that meets the standards to prove negligence or recklessness under current state law. So you can get away with negligence, you can get away even with recklessness, but boy, you better not show gross negligence. That's what the bill says. Fourth, the bill would enable corporations to be shielded from liability even if they make no effort to comply with the guidelines of the Centers for Disease Control, due to the way the bill treats non-mandatory guidelines. Why would Congress federally preempt state laws and then allow businesses to ignore the federal CDC safety guidelines? Fifth, instead of establishing strong, clear, enforceable federal safety standards by OSHA and CDC, the Republican bill would go the other direction and shield businesses from enforcement proceedings under federal health and safety laws. In other words, specifically protecting businesses from being held accountable under existing health and safety laws, federal bills. Laws like the Fair Labor Standards Act, the Americans with Disabilities Act, OSHA, and many, many more. Sixth, my Republican colleagues say this bill is aimed only at frivolous coronavirus lawsuits, but the bill would wipe out legitimate claims by workers and victims. By forcing all COVID lawsuits to meet a higher standard of care, heightened pleading requirements, limits on discovery, and other restrictive hurdles, the bill would make it, again, nearly impossible for workers and victims to even file a claim, let alone prevail. Seventh, the bill would upend the medical liability laws of all 50 states and impose 5 years of sweeping federal preemption for nearly all healthcare liability cases, including for claims that are not related to COVID. I went through this and read it over and over again because I used to deal with medical malpractice cases. And I've heard on the floor Senator McConnell and Senator Cornyn say, we've got to protect the doctors, we've got to protect the hospitals, we've got to protect the nurses. Well, that, of course, appeals to all of us because we feel such a debt of gratitude to the healthcare workers and what they're going through to protect us. So I took a look, and it turns out they compiled the statistics on the number of medical malpractice cases filed in America, in the entire nation, that mention coronavirus or COVID-19. Do you know how many medical malpractice cases have been filed during what they called a tsunami of frivolous lawsuits against medical providers? How many do you think in the course of this year? 6. In the entire nation of 50 states, 6 lawsuits. What a tsunami. And then the provision on medical malpractice goes further and says you don't have to prove that you were dealing with coronavirus to get this special treatment. You can say that the coronavirus had some impact on you as a medical provider. Some impact? That's it? What does that mean? The coronavirus has had an impact on every single American. Some impact. It basically means that all medical malpractice suits are going to be put on hold for 4 or 5 years, regardless of the circumstances, regardless of whether they had anything to do with COVID-19. Eighth, the bill aims to solve a problem that does not exist. We are months into this epidemic, no tidal wave of worker or victim lawsuits that justify this massive federal preemption of state law and grants of broad immunity. Out of 4.7 million Americans, and that's a lowball number, 4.7 million Americans that we think have been infected by COVID-19, 6 COVID medical malpractice suits, 17 consumer personal injury suits, 75 condition of employment suits. Most of the lawsuits involved in COVID-19 are between insurance companies. Does your policy cover, or does your policy cover? Ninth, the bill is entirely one-sided in favor of corporations. Under the bill, corporations get immunity as defendants, but can still bring COVID-related cases as plaintiffs. Only workers and infected victims have their rights cut off by this bill. And finally, the bill even goes so far as to allow corporations and the Department of Justice to sue the workers for bringing claims under COVID infection. The liability immunity this bill would grant would last for five years. The fact that our Republican colleagues are proposing 5 years of immunity for corporations, but only a handful of months of assistance for workers and families tells you their priorities. This Republican corporate immunity proposal is not credible, and there are serious questions as to whether it's even constitutional. This is an area traditionally governed by state law. 28 states have written laws to cover it. The federal government has deferred to the states on nearly every aspect of COVID response. This president said, leave it to your governor, leave it to your mayor. From testing to procuring PPE to mask policies to stay-at-home orders, there's no reason why the federal government now wants to step in at the expense of workers, at the expense of customers. I urge my colleagues to oppose the Republican corporate immunity bill, and I yield the floor.